Hello, everybody. Welcome, Rhoda and Joyce. Like I said before, we're very excited for today's session. And for anybody who's new here, every Wednesday in November and December, we have been hosting HerVersations. And HerVersations is a series powered by BellaNaija Style and WRTHY. And together we've been discussing issues affecting women in Nigeria, from mental health to issues like this, healthcare. Today's conversation is very interesting and I can't wait to delve in to the topic. So my name is Mary Edoro. I'm head of content for BellaNaija Style and I'm your host. So, really, poor reproductive and mental health, sexually transmitted diseases, violence against women, mental health, we know about all of these. And these are issues that are affecting women's health in Nigeria today. Now, we've already touched on mental health. You can go back to some of our previous sessions and listen to a lot of the things we've shared related to women in the workplace. And we'll be having a conversation on violence against women soon. But today we're focusing on low health service, lack of quality care, and gender inequality in terms of women's health. We have two amazing women, two doctors actually. I'm very intimidated by the doctors here, but we have two amazing doctors who are going to be speaking with us on today's topic, which is gender issues affecting women's health in Nigeria. We have Dr. Joyce, who is a medical doctor currently working in the United Kingdom. She's a strong advocate for women and the community with a focus on health education. She's also passionate about women's health education and empowering women globally to learn about their health and advocating for their health. She has also collaborated with WHO Africa to ensure women feel empowered making decisions in their lives. On the session as well, we have Rhoda Robinson, who is a second-time speaker on HerVersations. Thanks so much, Rhoda, for your time. We're very happy to host you again. She's the founder and executive director of HerVersations Health Initiative, which is a development organization focused on empowering and supporting undeserved population, that is women and young people. She's also an accomplished development practitioner with over 13 years of experience and a successful track record in developing and implementing high impact interventions toward addressing development challenges and achieving the goal of a healthy and sustainable society for all. I'm sorry I had to read this, guys. Their CVs, their bios are just so powerful that I didn't want to make any mistake with listing their accomplishments. I thank you both, Rhoda and Joyce, for your time today. So we'll just go right in. I think I'd just like to hear from both our speakers. Rhoda, can you please give us a brief intro to yourself and what you do with HerVersations Health?
Okay. Hi, everyone. Can you hear me?
Yes, I can.
Oh, okay, yes. So actually, I'm going to be standing in for Rhoda Robinson. Our flight was delayed, and she actually just left the airport, so that's why
Uh-oh.
I have to stand in for her. But it's totally
Okay.
fine. I would, I would stand in perfectly and also have a good conversation. So, as regards what we do at AC Health Initiative in terms of gender issues and women's health, AC Health Initiative is a non-governmental organization that's been in existence for now more than 15 years, and we've been working with women and girls to actually promote their health and well-being. And just of recent, we've been running this project called the Stop Cuts Project, which
Okay.
it's actually funded by the United Nations Trust Fund, and the focus of this is to reduce the prevalence of female genital mutilation, which is actually one of the gender issues that
Yeah.
affects women's health in Nigeria. And I'm so happy that, we're going to dive into this, really further. And we're working with 3 states. We're working with community members, with governments, with policy makers, because we understand that, to be able to effect change, we also need to work at the
Yeah.
policy level. So, even beyond that, we also work with adolescents on sexual and reproductive health. We work with women to empower them with resources, because when we talk about, social constructs that deals with women not, making so much money, we have to come into the picture and ensure
Oh,
that we empower women to be able to, to be self-sufficient and to also improve their agency. So, yeah, that's like, there's a lot to
okay.
talk about, but then I'm
Yes.
conscious of time. And I would also like to hear from Dr. Joyce. Thank you
Very,
so
very excited. You didn't tell us your name. Would you want me to refer to you as Rhoda?
much. Oh, I'm so sorry. My name is Oluwatomi Olunuga. I'm a program manager at ACL's Initiative. And yes, I was also the
Okay.
project lead on the Stop Court Female
Oh,
Genital
amazing.
Mutilation project. Yes, thank you
Amazing,
so much.
amazing. Welcome, Tommy. We're sad we don't have Rhoda, but we're grateful nonetheless. Dr. Joyce, I'd like to hear from you just before we dive into the conversation in full. What do you think the state of women's health is, in terms of in Nigeria as well as for black women in the United Kingdom?
Hello, everyone. Thank you so much for having me on. It's really an honor to be able to speak, especially on this topic because it's really close to my heart. So, I'm a doctor, currently a GP trainee, working in the United Kingdom, and for me, women's health is global health.
Mhm.
And growing up in Nigeria as well as working here, we can see there's still so much education and awareness that needs to happen. There is a lot of inequalities that exist, and we're seeing it through statistics and mortality rates and people presenting late and actually just not having enough education about what there is out there. So I think for me, whether you're thinking we're looking at women in Nigeria, we're looking at black women in the UK, it's we still have there's still inequalities that exist, and
Mhm.
that's because we still have lots of biases. And I think if we don't start addressing those issues, then we make a huge mistake for our future. Because I believe, for me, if you educate one woman and you save one woman's life, you save whole communities and families. So this is a huge discussion, and I'm happy to actually answer some questions and have like a proper discussion with everyone today on this topic because it's something I'm really passionate about.
Thank you, Dr. Joyce. We're so happy to have you as well. And I really like what you've said in terms of once you educate the woman, you educate the whole population, you educate everybody. And that's so, so powerful and important. Thank you. I can see a couple of people requesting to join the conversation. We're not quite there yet, but in a few minutes, I can allow more people to come in and add their 2 cents to the conversation. Okay, just to kick off, Tommy, I know you mentioned something about gender mutilation as citing it as one of the issues around women's health. What are some other gender norms that happen in Nigeria that contribute to the issues around health and health decision making for women in Nigeria?
Okay, thank you so much for that. So yeah, beyond female genital mutilation, actually, we also have other harmful cultural practices that are embedded in our communities and that community members actually hold on to strongly. So, the bulk of our work actually focus so much on community members. We try to understand them and understand, the issues happening at the community level. And then we also have, cultural practices such as early child marriage,
Mm.
teenage pregnancy, sexual harassment, and under that sexual harassment, I would like to also talk on street harassment because this is something that's becoming a norm in our society, and it feels like anyone can just they call it compliments, but then at times
It's
not
not
every
exactly.
women actually exactly it doesn't it's not comfortable for every woman, and it's becoming a norm in our society. So that is there. I think another one would be the gender pay gap issue, and it is something that is really strong in the health sector. The disparity between the amount of money earned by men is actually higher than what is being given to women, and they do the
Wow.
same work, the same job is being done. And there's actually a study that says that women actually earn 24% less than male persons, and then they do the same activity, and then women actually get to earn less. And a woman who ends up not earning so much won't be able to afford healthcare services. So even when pressing issues comes, when she probably is being diagnosed with cancer, she most likely won't be able to seek and also afford healthcare services. And also we have unpaid care work, which is actually we noticed that this was exacerbated by the COVID-19. The COVID-19 actually exposed us to a lot of unpaid care work that
Mm.
women actually go through, and there's studies that shows that this unpaid care work actually contributes to mental health issues amongst women. So because the gender the society believes that a woman is naturally a provider. A woman is naturally, a nurturer. So, she's expected to carry a lot of responsibilities at home, and she's not being paid for it. And imagine a woman who has to work and also comes back home again to do a lot of activities that is not being catered for, that is at times she's not even being appreciated for, and it's seen as it is just a normal thing in the society. Issues like this tends to affect the health of women. And also sexual violence is there. Like it's one of the issues that we are also trying to solve at AC Health Initiative, especially the fact that a lot of people don't report the cases of sexual violence, especially
Very true.
workplace violence, in school violence. These are things that are happening, but people keep quiet about it. A woman who knows that she doesn't have so much money and she needs to work, she needs to earn, she might be comfortable, not necessarily comfortable, but she might want to keep it quiet when she's been harassed at her workplace by her boss. And that's because, okay, one, who would believe her when she says her boss harassed her? Two, how will she continue to fend for herself? So I mean, the gender issue is a whole lot, and I'm so happy that we are having this conversation, because we want people to know about this issue, and for people to start taking action, to start taking steps towards the right direction, so that we can support women, we can ensure that our environment is safe and is accommodated for women, and at the end of the day they get to also improve their health and well-being. Thank you.
Thanks, Tommy. It's so interesting that you mentioned unpaid healthcare. We did have a session 2 weeks ago on unpaid healthcare, and it was such an interesting topic. It almost became very controversial because, on one hand, we had some women saying, you know what, it's a choice for sorry, not unpaid healthcare, unpaid
Unpaid
domestic
work.
work, unpaid
Yes.
care. Yes. So we had some women saying, oh yes, I've chosen to do this and it's fine. And some women were of the opinion that, you know what, the truth is women shouldn't be thought of as, you know the sole gender that needs to be the one doing the care work. So it got very very controversial, but it's interesting to hear you mention that as an issue surrounding women's health. And I completely agree. In terms of mental health, these are some issues, some factors that we need to consider as a woman, even if it's a younger lady who
Yeah.
probably has to bear some sort of responsibilities at home, to even a married woman in her home. But you also mentioned gender pay gap in terms of women in the healthcare industry. Dr. Joyce, do you have anything to say about that? What do you think? What are your thoughts around that? Is this something you've experienced personally?
I've worked in the UK most of my my working career, and so from what I know, in terms of early on, we're supposed to have a basic kind of pay. But the
Mm,
issue, what happens with this is that women, we have when we may need maternity leave, we need more time off in terms of raising kids, things
mm,
that men may not necessarily have. They don't get pregnant for 9 months and carry the babies.
mm,
So even if they have paternity leave, they only have a couple of weeks off, and we have couples of months off. And there is data to show that there's certain points where women actually, we definitely still make less, even in healthcare, even in a system where it should be standard. Because by the time I'm on a level at the same level as a male doctor, if we're at the same level, so if we're both 5 years of experience, it should be standard in terms of what you're
mhm,
receiving and what I'm receiving. But again, that is still not the case. So yes, if when we come to that, that's even a big that's a bigger
mm,
topic. But
mm, mm,
there's still inequalities in terms of in terms of the needs we have as female doctors, the pay as female doctors, and so much more.
mm. Wow, very, very, very interesting. Before I head back to Tommy, I would like to ask you, Dr. Joyce, from your experience, now let's move it back to the people on the receiving end. From your experience, is there any gender discrimination in health service delivery? I know I've seen some things on, I think, Twitter, where some Black women and even Nigerian women as well have spoken out about, the way they're being treated in hospitals by even healthcare workers. In Nigeria, I've heard stories of the midwives beating the pregnant women, when they are maybe slapping them when they're screaming, when they're in labor. I've heard some of these things. can you speak on that? Is this something you have any knowledge of?
There is most definitely still gender discrimination in the delivery of care, and I think you can think about this on different levels. I think if you just think about it as you're coming in with health symptoms, with a symptom of pain, there are actually studies to show that, if a man says he's in pain, he's brave. If a woman comes in and says she's in pain, it's like she's being emotional or
Wow.
dramatic. And I
Wow.
think there was a survey that showed it didn't matter whether the physician, so we're not saying male physicians are more, no, it didn't matter whether you were a female or male physician. Sometimes there are actually inherent biases that were there, because lots of healthcare professionals thought that women actually exaggerated their pain. So these are little things that you need, not little, they're actually huge
Yeah.
things that can either stop someone. If I come in and I say I'm in pain and you don't believe me,
Mm-hmm.
again, I don't feel like I'm being listened to. Not only is that going to not, you're not going to find out what's going on, but I probably won't show up again. I probably won't
Exactly.
feel motivated to want to access healthcare. There's also still a lot of gaps in terms of medical research. So even when it comes to the medications that we have, lots of it was actually tested on men and not women, because we have periods, we have, hormonal imbalance, things, we are more likely to, if we're pregnant,
Mm,
it may be harder to get drugs tested. So even on that type of like scientific level, in terms of medication, there are biases that exist.
yeah.
And actually, in terms of Nigeria, and I think for me as a healthcare professional, I have to speak from the healthcare professional side, because we also have to make it, you are doctors and nurses and midwives, play a huge part in educating and advocating for women's health, for health in general. And so if there's been lots of studies and stories I can share, that where you speak to doctors and they don't feel like, if you're not married, why should you be looking for contraception? If you're not married,
Yeah.
people look down on women coming to look for
Mm-hmm.
contraception or coming to try and on family planning. Lots of doctors think, women should always come with their husbands and should not make decisions without that family institution. But the truth is that just like a man has his rights and he has his own, say over his life, women have their own say over their life. And as physicians, we need to address those traditional norms we also have. Yes, there's a way everyone grows up, and when you become a doctor as well, you may keep those inherent biases which could cause problems for your patients. So I definitely think there's still lots of gender discrimination. I've seen even the racial discrimination. So even for Black
Mm-hmm.
women in medicine here, there are times where I know I've had to step in and be like, look, she's not shouting. She's just trying to express herself. She's trying to tell you that she does not like the way, she's being treated, and she wants you to listen. So I think there needs to be a lot of education, yes, both on, women, or for us to understand more about our bodies and what's going on, but really on a healthcare professional scale and on a public scale, and really start addressing those norms that can be really dangerous. Because what happens is that lots of the norms that we spoke about earlier, in terms of early, can, lots of the gender norms that we have lead to forced marriages, which lead to adolescent pregnancies, unintended pregnancy,
Yeah.
sexual and physical violence. And then on the other hand, we're not allowed to speak about reproductive rights. We're
Mm-hmm.
not allowed to speak about contraception. We're not allowed to speak about family planning. We're not allowed to speak about periods and menstruation. So there's so much we need to address in terms of the education, and it's at all levels. And we need to make sure that as healthcare professionals as well, we're not doing a disservice to our women, and we're creating spaces where women feel comfortable to come in and advocate and empower, and just feel empowered, to speak about their health.
Yeah, thanks. Thank you. I think that pretty much sums this up, because really the task lies in the hands of the service provider to make their, in quotes, customer or client or patient feel the best. And it doesn't even have to be, oh, you're just giving them drugs or you're giving them medication, but taking care of them in general is also very important. And like you mentioned, a woman who goes and she sees that, oh, I'm being mistreated, even when I came to complain about my issues, would likely not come back there. So Tommy, I want to ask, so in Nigeria, it's very rampant. You see these stories of midwives beating people, reproductive health issues, young ladies, young unmarried women not being able to speak up about reproductive health issues, or ask for contraceptives, these types of things. But women in low and middle income homes are mostly affected by these issues, even worse and harsher conditions, especially as their access to these things are very limited. What would you think are some ways to remedy this?
Yeah, oh, thank you so much for that. And yeah, I totally enjoyed what Dr. Joyce said, like in terms of sexual reproductive health, like it's really, really speaks to this. So, in terms of what we can actually do, to promote sexual and reproductive health services for young people, for women, especially those in underserved communities, I think one of the first things that we should do, like she said already, is education, to educate people about this thing. Beliefs are very strong, and we can see that cultural norms, religious beliefs actually impact a whole lot of our activities, a lot of our interventions. Like I mentioned earlier, ACL's initiative, we're running this Youth Amplify project where we're actually working with young people to promote their access and information on sexual and reproductive health services. And a bulk of our tasks actually focused on research, trying to understand why are these young people not using the services. And a lot of conversations around my mom will complain the way health workers will treat me and all that. And we can actually see that we even need more information to understand from both perspectives, both the service provider and also from the receiver, because with information we are able to plan and design interventions that will target this issue. But if we don't have concrete information, and especially gender disaggregated information, because the experience of a woman, of a female, is different from the experience of a male, and we need to be
True.
able to apply a gender perspective into our data. So most of the time when we see data, they just categorize it like, okay, 15 to 24 years old, 60% don't use this.
Yeah.
But okay, who are those 60%? How many of these males are using this? How many of the females are using this? So, so in terms of research, in terms of data, we also need to apply a gender lens. And also we need more policies that would, encourage women, or policies that will actually support women's access to contraceptive, to sexual and reproductive health. And, with policy, we can also increase funding, when there's a law that is backing this intervention, sexual reproductive health interventions, easily NGOs can advocate for more resources to be pulled into those interventions when it is clearly stated in strategic plans. The funny thing is that when we probably want to check out if Nigeria actually has like a sexual reproductive health strategic plan. When you review the strategic plan, you get to see that there are a lot of gaps in these things, and then we
Mm.
wonder who is following up with these things, who is ensuring that
Yeah.
these plans are tracked, who are we going to hold accountable for some of these things if it is not being implemented. So if you say this should happen between 2021 to 2025, how are we going to track it? A lot of these things are there. So that's also at the government level, and also at parents, at the family level. Yeah, at the parents level, we actually also need interventions that are targeted at family members, at community level. To encourage them to be open to the use of sexual reproductive health services,
Mm.
especially for adolescents. Honestly, this is one vulnerable group that has actually been, I can say, they've been marginalized from research and also intervention.
Yeah.
And we like, studies actually shows us that the sexual debut age of adolescents is actually like a lot of them start having sex between the age of 9 to 9. You see some 9, you see some 11, some
Wow.
12, 13, and even cases of teenage pregnancy. And we know
Mm-hmm.
that when a teenager gets pregnant before the age of 18, she actually increases her risk to maternal complications and also complications during delivery. And these are silent issues we are not talking about. And we come and we say maternal mortality rate is
Mm-hmm.
high, but then we have these teenagers who are not being, given access to contraceptive services, to sexual and reproductive health services, and it's affecting them. If we also take a look at, at the family level, say maybe a woman who is even married, and she is of the opinion that she wants to take contraceptive, or she wants to be on family planning, and her husband is not in support of it, due to diverse reasons. So we also see that we also need to increase male involvement in this conversation. Like,
Yeah.
men also play an active role in ensuring that we promote sexual and reproductive health services. So when we target our programs to them, they also get to be more supportive, and they get to be more open to these conversations on this. And also, I think health workers, also just like Dr. Joyce mentioned
Yeah.
earlier, they have a
They
lot
have
of
a big
things to do.
responsibility to
Yeah.
play in this. Yeah, yeah. Thank you, Tommy. And I keep hearing this about like the adolescents' health, the teenagers and teenage pregnancies, and I think it's something that at this point, any mother or any older person in society, if they castigate a younger person for getting pregnant or for being involved in some, it's just at this point, it's just bad, it's just wrong, because it's so rampant now, and we have so many other factors that we need to consider before you completely castigate the girl or the girl child, etc. Dr. Joyce, I'll just come to you real quick, since we're talking about adolescents and young people, and I know you do a lot of work with young women and that empowerment and the youth. What are some taboo topics concerning women's health, in terms of women's health, that you want younger people to speak up more about? What are some of these topics that you feel like younger people need to talk more about concerning themselves? They shouldn't be afraid to be stigmatized based on these topics. What are some of them?
Tomi, thank you so much for that, because I think everything it's education of both women and men, and it's at different stages. So I totally agree with everything you said. And even to answer this question, there's so many topics. To even choose one is difficult, because I think, Tomi, you spoke about the parents level, right? Because education actually starts from very early on. What are we actually allowed to speak about? And the first thing is actually having healthy conversations around periods and menstruation. I know a lot of us growing up actually we were almost embarrassed to start our period, because we didn't have that much information on what it
Yeah.
is, what it meant, if it was a bad thing or a good thing. And there's still so much stigma around it. People don't speak about having very painful periods, and knowing that painful periods are not always normal. That's not always a normal thing. So there are many. For me, I would say let's start with the basics. Let's start with periods and menstruation, and understanding what that is, and understanding that as women, we're all going to go through it, and it shouldn't be a dirty thing. It just sounds like it was always like a thing that I don't know if I want it to happen to me now. So periods, a huge topic. I would say the next thing is first, even without going into sexual and reproductive health, I also want to talk about mental health as well for
Yeah.
women. I think it's extremely important that we touch on that, because when we're not able to speak about any problems that we have, or we feel we're not able to express ourselves, our mental health plays a very, very huge part. So I think that's another thing, that there is a huge stigma, and I feel like now for the younger generation, we're a bit more comfortable speaking about how we feel and expressing ourselves. And I think it's important to continue to encourage that. And then, rather than taboo, I feel there's a lack of conversation really about, the different conditions we could get. Fibroids, they're more common to
Yeah.
have it as a black woman, okay? And in Nigeria, most of my friends didn't even know what fibroids are. And
Wow.
we're well about 27 to 28 years old.
Yeah.
PCOS is another very common condition that happens in young women. Even going up until, okay, if we talk about, and then sexual STIs, which is a very, very important topic. We don't talk about, no one wants to talk about sex, because one, it's a bad topic to have, when you're
Yeah.
growing up. Girls are not allowed to speak about it.
Yeah.
But then, as you've said, we have a lot of teenage pregnancies, so the scare tactics are not working. So we
Mm-hmm.
need to have more education on sexual and reproductive health, on how to get tested, what medications and what medications are available for if you have an STI. It's not, a death sentence. I think a lot of people don't understand as well that when you have changes to your discharge or you have STIs, that there are medications that can actually help. And what happens with a lot of us is that, no one talks about it. You wait for the infection to go on its own, and it causes bigger issues with fertility and also all sorts down the road. So there are many topics. I can go into fertility and, the pressure to have a baby, either the
Mm,
pressure to have a baby or the fact that you cannot, it's not easy to have a baby. There's a lot
exactly.
of pressure around that, and the mental the mental health stress that goes on around that, and the lack of education into understanding the factors that may affect you being able to have a baby or not. And then even speaking about menopause, I did a talk recently, and actually most of the people I was speaking to, they had already had babies, but a lot of people didn't know how to check their breasts. They didn't know what the cervix was, which I would understand as well if people don't know here, because the cervix is one of those organs in our reproductive system that was left out in biology class. But we didn't know about, and they also were not sure about the next stage of menopause. So when you say what are the topics, there's several topics. And I think it's just starting to say it's okay for us to speak about our bodies. It's okay for us to
Yeah.
speak about the things that happen to each and every one of us. And we need to start creating, information, putting that information out there from trusted resources. And I feel like we don't have enough of that. So what I try and do is do shorter videos. How would the younger generation listen to me, or even the older generation, because now we have WhatsApp and Instagram, and really trying to use short form videos and social media to also spread education and awareness around these topics, and
Mm,
not just everyone hiding and, not talking about it, or talking about it within their one or two circles. I think it's important we speak about it on a almost on a global scale.
yeah, yeah. Thank you so much, Joyce. To everybody just joining in, thank you for joining in. Today we're talking about gender issues that are affecting women's health in Nigeria. And if you have any questions, we have two amazing speakers here today. We even have Dr. Joyce as well, who is giving us real gems. So if you have any questions, any personal stories that you want to share, personal experiences, please you can now request to join the session, and then I'll let you in so you can ask your questions. Okay, great. I think the conversation has been going really well so far, and we're really hitting all the spots. Joyce, you just mentioned some really key topics, and I know you're saying there's so many, but I think these are the very top ones that are affecting women in Nigeria here. And these topics, we really need to speak about it. We need to talk to someone, go to a medical practitioner, and it goes both ways. So now we're saying speak about it, don't be afraid to go, as well as medical practitioners should also be a little kinder. They should also consider other factors and remove all sorts of bias or conceived norms that they have put in themselves about women when they're seeking some services. Okay, I know you touched on this, Tommy, but I really want you to tell us, what is the role of the government or health institutions like yours in destigmatizing these taboo topics when it comes to women's health?
Okay, thank you so much. I think one of the first thing that we need to do at the policy level is to actually first increase the involvement of women at the policy level. So let us ensure that we have more women at the table speaking, advocating, enforcing these policies that actually promote, women's health. Because it's very simple. It's a woman that understands what another woman might be going through. So you get to even realize that at times when we go to the policy level and we advocate for new laws. Take for instance, when we're trying to advocate for the enforcement and implementation of female genital mutilation laws across 3 states in Nigeria. Some of the issues we actually faced was the fact that we had a lot of men who didn't understand what we were talking about. And a lot of them still held on to this belief that, yeah, a woman should be mutilated, a female child should be mutilated. So, but when you actually
Wow.
when we started targeting women at the policy level, so say maybe the chairman of a particular local government or the chairperson of a particular local government who is female, or a female police, or at the MPF level, they understand. So they were actually more supportive compared to compared to the males. So you see that if we don't have women at the table, a lot of our advocacy efforts, a lot of our program efforts, actually, it's not going to stand so strong at the policy level. So the first thing we need to do first is to ensure that we have more women represented, at the policy level. And also, we need to also strengthen our advocacy efforts. A lot of non-governmental organizations are doing great work in terms of promoting, women's health, sexual and reproductive health, maternal health. But a lot of campaigns are going on, but we don't really have so much advocacy targeting the government, raising the noise, increasing the noise around this issue. So if we have more, NGOs, CSOs that are strengthened, that have the capacity, to carry out advocacy, because it's not everyone who can actually conduct effective advocacy. So we also need to strengthen the effort of this NGO such that they'll be able to, implement this at the policy level. And we can also make use of every single platform we have. Media, like media is a very strong platform we have to get these people's attention. Like it was a great one we did during the Sorosoke incident and all that. And we can see how much youth engagement coupled with the use of media actually brought up so much attention. So we can leverage on media platforms, we can continue youth engagement, ensure that youth are at the top of these conversations talking about this thing. Their energy brings a lot of change into this conversation that we're talking about. Yes, thank you.
Thank you so much, Joyce. Those are some really powerful points. Dr. Joyce, how do you use your own platform, or what are some of the things that you do in terms of women's empowerment of the young people, and these topics that we're talking about?
Thank you so much, Sumi. So for me, as I've tried to look for how can we actually get to the younger generation, and just how do we get to women and actually give information in a way that they will understand it straight away. Because another thing is that when it comes to women's health, people get scared because the only time or just health in general, most times the only time you're learning about health is when you're going to a doctor's office. There's so much nerves and stress that kind of goes into that. So what I try and do is almost give information in a way that in a space where you're already doing other things. And so for me, I've tried to use social media a lot to be able to communicate with women in terms of doing 1-minute videos on any topic. So if my friends, for example, come and want to learn about fibroids, what I will do is do one video on fibroids for that one friend. But if 1,000 women watch it, that's amazing. So I think it's actually addressing real needs. So my real, like, people around me, what they want to know about, whether it's periods, whether it's fibroids, endometriosis, all sorts. So I've used social media in that way. Some things I also do is try and go into spaces where women feel the most comfortable. And I'm currently actually building an organization called Aranini. We're about to launch one of our events in December, but it's really trying to speak to women where they feel the most comfortable. If I ask you, where do you feel the calmest? You will say with your friends, when you're doing your nails, when you're doing your hair, when you're shopping. So I'm like,
Yeah.
okay, so we need to make women's health, we need to bring those conversations into those spaces, into spaces where people already feel calm, not in spaces where I have to go to hospital and I already think something is going to be wrong with me. So that's one of the ways where I'm trying to really, really break down those boundaries and break down the walls that are between that we have when it comes to health, because I think there's still a big distance between the policymakers, the healthcare professionals, and the patients, and we want to be able to almost connect in a way that people feel most comfortable. So for me, it's definitely using social media, so either Instagram or TikTok, and really breaking down the myths that exist, and also just giving education on really common topics. And as I said, I start with asking my friends, I start with asking people around me, what do you want to know about? Because if you want to know about it, somebody else will want to know. And I think one thing that I try and highlight is that you are literally not alone. If you're having that symptom, trust me, there are many people around you that may have, but they just don't know how to say it. No one knows where to go and express that. No one sees a young person necessarily talking about it. And another thing is that sometimes you may see the older generation talking about it and it feels like, but you just don't get it. So I feel like I try and almost give that younger perspective in terms
Yeah.
of, yes, I've been there, I've been a patient, I am a doctor now, I've lived in Nigeria, I've lived in the UK, I've seen many things of how I feel like things should work. And for me, it's like, let's make those conversations normal, but let's bring it to places where women feel the most comfortable. So hopefully with this events I'm trying to organize, I'll be able to share with you guys, and we can get more
Yes,
women and
please.
have more of a community feel
Yeah.
about it and just have these conversations.
Yes, please. Well done on your initiative and the event. Yes, please let us know more details. And I want to say well done. I think you do that great work with your platform as well, from that personal level, and it's just like a girl's chat telling you about like serious issues concerning health. So I think that's really powerful as well. So guys, we're rounding up the conversation, so if you have any questions, this is the right time to ask them now, before we get our two professionals off from this call. So please ask your questions, request to join in, and I'll add you on the speaker list. Okay, Tommy, just to sort of round things up, especially with the work AC does with women, women's health, women's empowerment in Nigeria, what are some targets that we can set in terms of policy, financing, and action to ensure that the future would bring health services closer to women and girls?
Okay, yeah. So from our learnings and also our experience working with women across diverse projects, we can actually set targets in increasing the access of healthcare services to women, especially noting the fact that the maternal health care period is very important. So things like antenatal care, postnatal care, we should start thinking about how we can bring these services closer to a woman, because you know already that a woman at one point or the other, if she wants, would get pregnant, would deliver a baby. So these are like this is like a norm, and so services that actually promote the health of a woman at this level should be focused on. Then also we should also improve women empowerment. We should improve policies. We should have policies and also programs that focus on women empowerment, increasing their agency, making them know that you can stand alone, you're fine by yourself, you can make decisions by yourself, not necessarily waiting for a man to make certain decisions
Yeah.
for you. Because we realize that by the time you improve a woman's agency, indirectly and also directly, you get to also improve her health, because she can
Mm-hmm.
make decisions for herself as regards her health. She can seek healthcare services anytime she wants this thing. So we can see that the women empowering women, improving their finances also has a role to play. And also we should also improve, access to education for the girl child, even for women. No matter the age, there's something new you can learn. You can improve on your knowledge, you can improve on your skill. So we should ensure that we get our girl child into school. And we should also ensure that even at the secondary school level, or even if it's tertiary institution, we should ensure that we have services that are gender centric, services that take note of the fact that we have both males and females in this place. So things like menstrual pads being available, having toilets where females can actually go change. So these are things that we encourage a female child to even stay in school, because from our engagements with young girls, we realize that the fact that they menstruate, some of them miss schools because of menstruation, because they don't have toilets in their schools. So this is also another area that we could also target, and we should also ensure that we increase the enforcement and implementations of policies and laws that actually ensure that women's rights, women's health is sustained and is also ensured across all levels. So when I say across all level, it's not only at the national level, even at the local level, at the community level. We should ensure that these laws are implemented. Is the local government chairman aware of these laws being available? Are the people there also aware that they have laws that protect their rights, that protect their health? So we should go beyond just leaving our laws at the national level, but also ensure its implementation and its enforcement also at the local government level. Thank you.
Thank you, Tommy. Thank you for the amazing points you've shared. Fife, hi. Do you have a question, or is there something you want to contribute to the conversation?
Hi, thank you for bringing me up, or at least accepting my request to speak. I just had a question, really. Well, a couple of questions, but I think they're all tied to the same concept. You know, one of the things that we do, or at least that I do, is essentially trying to um, use the voices of platforms of people like, organizations and people, right? Like BellaNaija and, celebrities and influencers in general, who we know that young people are listening to, and just people in general are listening to and kind of taking cues from. I mean, we all know the power of media. We all know that every things that we see on, whether it's TV or in our social media, are the things that are shaping our behavior, right? From even before social media. Every time, if you look at society, you can see that there's a trend, that it's actually the TV and radio and all of that informs how we act and how we behave in society. So I guess my question is really for the Hasty team, and I mean really and anyone else really that and maybe even Dr. Joyce, anyone else who really is working with young people, to really just understand, if you have an idea of who are the real people that these young folks are listening to, right? Because I guess my question, the reason I'm saying this is that if it's that we need to maybe shift our strategy to focus more of our energy around creating content and just content in general, whether that's short form, long form, whatever that looks like, and then maybe where are the young people viewing these content, right? So that, because at the end of the day, right, if we can get some support, right, to create content for, say, maybe Hasty, for instance, do you guys have channels, right? Or do you have preferred channels where you think, oh yeah, there's a ton of young people that are on, I don't know, channels TV, that watch channels TV. I don't know, I'm just throwing a random media source out there. But where do you think young people are particularly spending most of their time, especially those who are obviously disenfranchised and are in more lower income areas? Most of us on here are probably not really as distressed, because we have access to data. So that means we obviously have some kind of spending power to be able to purchase data and have a smartphone. But for those people, for the majority, I'm assuming they don't necessarily have access to Twitter spaces, right, to listen to this conversation. So for those people who are the majority, especially young people, I guess my question is, what are the channels to reach them? Because we obviously cannot go physically and reach everyone in physically, right?
Yeah.
Even if we can, it's slow. It's obviously much slower, right? We've been doing it, right? Hasty's been doing it, and many other organizations. We know that there's a power in media. So basically, I think in all of that, what I've said is, what would you guys, anyone really on this call, I mean, on this conversation, what channels would you recommend, right, to use to spread some of this information out, to the young folks, or to the people that need to learn, this information, and whose behavior needs to shift?
Oh, oh, okay. Um, I I think, Tommy, you'd like to take this.
Actually, Rhoda is back on the call,
Oh,
so I think we should give it to
hi,
her.
Rhoda. Can you speak?
Yeah, hi
Okay.
everyone. Sorry I
Hi.
am joining so late.
No
Um,
problem. Tommy has done a
airport.
fantastic job so
Yeah,
far.
she did. I am like super psyched listening to her talk and sharing so much information. Yeah,
Yes.
and then it's wonderful to be here again, and so good to hear from you again, Fife and Joyce. Okay, so since we're wrapping up, I'll just like quickly just speak to what Fife has said, and like
Yeah.
just drop a little tidbits on collaborating on what Joyce and Tommy has also said. And
Okay.
as Fifa said, a lot of young people are not on Twitter Space. I didn't get on Twitter Space till like earlier this year, and I'm not so young. I have the resources, I have the time, I have everything I need to be on the space, but I am not here that often. So imagine when you don't have that kind of resources. And what we've realized, working in Haiti, working with our communities, working with our beneficiaries, is that there is no one solution. So we stopped thinking in the one solution aspect. We stop thinking in the one platform aspect. And we've evolved into a sort of hybrid model that's connects everything from WhatsApp status messages to voice notes to 30 minutes videos to GIFs to every single mode of communication that we can use. We use it to reach young people. And then it's not just about creating that content, it's putting the content where these young people go. Like, I'm a TikTok stalker. Like, I stalk everyone on TikTok. I watch everything. I absorb information from TikTok. And you'll be surprised in how much information you can get from a 15-second TikTok video. So those kind of places, we all know people that have followings. A lot of young people follow social media the personalities. They follow media personalities. They follow everybody. Everybody follows somebody. And if we can get that information in the different sizes that we have it, in the 10 minutes videos, in the 2 minutes videos, in the snapshots, in the images, if we can push that information through those people, through the Fifes, the Joyce, the BellaNaija platforms, the Joker Pearl, everyone, if we can start pushing the information we have, no matter who sees it, we'll find out that a lot more young people will get that information. And then it trickles, it flows out of the digital space and it flows into the real world. It flows into the physical world. And you hear these discussions when you go into communities, when you go into schools, you hear them talking about the same thing you've posted online. And that's where you see the effectiveness of that little WhatsApp image or graphic that you just sent on one of the random platforms that you just happen to be a member of. So things like that actually reach the target audience. And as Joyce said, one person might ask the question, but 1,000 people might need the answer. So it doesn't just, you shouldn't wait till you have 1,000 young people asking for a service or an information or a platform before you provide that service. Being able to serve just one person and having that person, putting it in a space that other people can also reach it, makes the world of difference.
Very, very true. Thank you so much, Rhoda. I think that was just a beautiful end to this our conversation today. The truth is, there are so many diverse platforms right now, and there's so many people. So it's our responsibility as individuals, as people who go through these things on a daily basis, as human beings generally, to just constantly preach the word, share your own experiences. Don't be afraid to share. Go ahead, share, post, even though you're not any medical practitioner, you might have some questions that you want answers to. So post, go ahead, do it, and just let's try to treat each other. I think that's also really powerful, because I think people in healthcare are more on the authority level. So let's try to be a bit kinder, and just treat women nicely, basically. But yeah, thank you all so much. I don't know if yourself, Rhoda, or Joyce, you have anything else to share to round up the conversation, but thank you all so much. This conversation has been so amazing and very enlightening, really. So many things I didn't know in terms of the gender pay gap for women working in the healthcare space. So this has been so eye-opening, and I thank you three for joining in. Tomi, Rhoda, Joyce, thank you so much, as well as Fife, for coming in with the question. So thank you all so much for joining. Next week, we continue with HerVersations by 6 p.m. on Wednesdays. Next week, we're going to be talking about investment and all things money in terms of women. So please join in, and don't miss it by 6. Thank you all so much. This conversation will be available to listen to on our YouTube channel soon. Thank you, everybody.
Thank you. Thank you for having me.
All right. Bye, guys.
Bye.
Thank you. Bye.
Bye.